Fibrous dysplasia. What is fibrous dysplasia? It is the abnormal bone growth where normal bone is replaced with actual fibrous tissue. I chose this subject based on the study of the skeletal, and this particular disease is not hereditary. It is actually a genetic disorder. There's no known cure, and my 17-year-old son was diagnosed with this disease when he was 10. It's not cancer, but the tumors that grow with this disease actually are benign. But what happens is the patients who have this disease have a 400% chance, higher chance, I should say, of getting cancer. If we look at the pathophysiology, it's actually an expansion of bone. It can either be in one bone, which is monostotic, or it can be in many bones, which is polyostotic. My experiences over the past 7 years of patients I've talked to and family members and doctors, about 75% of the patients are monostotic in one bone. Many people end up with endocrine diseases, so I know that for a fact that my son goes to his doctor quite often to check his thyroid, his pituitary gland, and they make sure that he's not having any difficulties with that. There's also the presence of the endocrine diseases, skin pigmentation, and the presence of fibrous dysplasia actually can constitute McCune-Albright syndrome. Symptoms. With my particular situation, my son had proptosis of the left eye, and we thought it was allergies, and the eye kept popping out more and more and hanging kind of down. So we ended up having a CT scan where they found a very large tumor. It was 2.5 centimeters. I'm going to say about the size of a golf ball. And so they had to go in there immediately and do a craniotomy. He didn't even leave the hospital. We ended up just staying there, and he was there for over a month. And they thought he was possibly going to get meningitis because there was a tear in his dura, which caused a brain fluid leak through his nose, and they had estimated his nose had been dripping brain fluid for about 9 months. So sometimes there's pain with this disease. My son had no pain, but there were some patients that had it in the legs and the thighs and the hips, and they suffered severely. Many of them had multiple fractures, and they couldn't go to school. Treatment is pain management therapy, bone strengthening medications, but those medications actually have side effects. Surgery had to be done on several patients that I talked to, including my son. He had 5 craniotomies, and they had to fix that brain fluid leak I discussed earlier. They also removed quite a bit of damaged bone and had to rebuild his forehead, and they had to remove his left upper sinus, and he has multiple plates in his head. They had to use cadaver bone to fill the upper left sinus, and he's been through a lot in the last 7 years with this disease. It was quite scary, actually. Class reference. Because this particular disease hits a personal note at home, I referenced it back to technically the skeletal of our being, chapter 6. So without our proper bone structure, we'd kind of be like Gumby, that cartoon character, or Jello with no support. So if the bones are brittle and weak, it's almost like an old person losing the calcium and the structure, the bending over. So the bones are calcified, and with fibrous dysplasia, the bones become very brittle. It It's like holding coral in your hand. It's very sharp and grainy, almost like a sand. And it can be very disfiguring because the bones don't continue to grow right. They get weak, and it's almost like a sunken in. So it's either an expansion of the bone, similar to the movie Mask of the boy who had the disfigured face, or it can be a sunken in. I've added some pictures I'll show you in a few minutes. Our bones provide the shape and the framework of our entire being, and it supports our internal organs. So in the instant with my son, the orbit holding his eye was deteriorating, and he almost lost his sight, and he almost lost his left eye. And the actual eyeball itself was being forced out from his body because of the disease. Healthy bones are important for our tendons, our ligaments, and our complete anatomical structure. So it was quite a problem with my son's brain fluid leak, and they thought he got meningitis. He had to be in a tent in a confined environment. Everyone had to dress up like in spacesuits, and they had mentioned that if he had not had the surgery within those few days, he probably would have been dead in 30 days because it was really, really bad, and the brain fluid leak was really bad. In conclusion, fibrous dysplasia is incurable. There's no cure. They don't even barely know where it comes from. They just know that they've limited it to the GNS gene, and they believe that it's already in the fetus in the mother's womb. Many times it's undetectable until a symptom arrives, such as proptosis of the eye, multiple fractures, broken bones. We were due to go to the University of Bethesda, Maryland, which is where they do a lot of this research through the Fibrous Dysplasia Foundation. But the gracious doctors at UCLA, a very famous brain surgeon, Dr. Lazareff, and a very famous surgeon, plastic surgeon, chief of plastic surgery for pediatrics, Dr. James P. Bradley. They saved my son. They rebuilt his forehead, his sinuses, and he looks really, really great. I went through the fibrousdysplasia.org Foundation, and I went through the universities. I also went by some of the medical terminology in Chapter 6 about the bone structure. It kind of can relate back to some benign tumors as well, because this disease tends to make tumors. This is a picture of a girl who's got fibrous dysplasia on the right cheek area. This child has it underneath the right, probably a facial. This is all the skeletal skull of it. This is facial, so it's right on the right cheekbone. And you can see the disfigurement. This is very similar to how my son's eye was kind of going down and out. It didn't get as bad as this woman's, but if I would have waited any longer, it would have. And so they had to basically rebuild the left forehead area and the sinus. It actually went and destroyed most of his left sinus. This is some weak bone x-rays that you'll see that it's kind of grainy, and that is the bone that's just falling apart. It's becoming like sand in this poor person's legs. And these are some doctors. It was kind of not a great picture, but these doctors are treating this child that has it all in the skull and facial area. It's quite disheartening. So this is Brenda Lafarge. I'm signing out, and I hope I was informative on my slide presentation. Thank you for your time.